first, I want you two to just introduce yourselves and give me a little background of what you guys do.
So I'm excited to be here.
Excited to have you.
Thank you. Because I am, on the real life level, I'm a mom, I'm an author, I'm a podcaster, and a TV personality. So I am a regular person on the day-to-day, but my business is pretty cool and high profile. But I also am a divorcee. I was married for 12 years, and I'm an adoptive mother, meaning I already have an 11-year-old, a 21-year-old, and a 24-year-old. So I've been a mom for 10 years.
Okay, so these kids are, so your new
This will be my first time carrying, potentially.
Okay,
so it's a really a fun experience in a way, because I became a mom at 28 when I adopted 3 girls after meeting their mom on the side of a street in Baltimore. You can learn more about it in my book.
Okay,
it's there.
Okay.
Because that is, I have too many questions for us to sit here and talk about the kids I already have.
Well,
they are already here. We need to talk about the future babies.
Yes.
I've had the benefit of really living an entire life already
as a mom.
And my kids are great, but I'm definitely feeling the pangs as I put my little one into middle school. And I'm like, I am 38. I'm still very fertile, God willing and all those things. And I would really like to, in my new relationship, I'm with someone now. It's been years. We'd like to have my first biological child and our first child.
Totally understandable.
So knowing that that's the case, I would love to know more. I am very aware of the statistics around, Black maternal mortality. I'm very aware of, issues. It's actually National Pain Awareness Month, so I'm just very aware of the perceptions of pain amongst people of color from the medical world. And I'm also, age notwithstanding, I'm aware that I am statistically a geriatric mother, but I don't receive that. You know what I mean?
No,
I don't receive that in any way. It's just a label. So I'm super excited to be able to be here. And thank you so much for giving me the opportunity, because I've heard great things about CCRM, and there's one right nearby me in Newport Beach.
Yeah.
So I'm very excited to start that journey, learn more. This is going to be so good.
Okay, amazing.
Yeah.
All right. Okay, and Dr. Stephanie Marshall Thompson.
Yeah, so I'm Dr. Stephanie Marshall Thompson. I'm a reproductive endocrinology and infertility specialist, always that tongue twister. And I'm with CCRM New Jersey. So I'm very excited and happy to be here to answer all the questions and just also share from, I think, a real world perspective, as you brought up. I'm also a mom, I'm a wife, I'm a working mother. And I think that my approach to fertility and to patient care is one that's really all encompassing. And I think it's great to just talk about who we are and how that affects our fertility. Super excited to talk about Black women and infertility as well, and just some of the things we go through in the healthcare system as women, as Black women. And I'm really glad to have the opportunity to educate about this. So I'm happy to be here.
Same. We should really get into, I guess, your experience right now as a woman that is looking to have your own biological child. Any fears, what do you, when you think about having your own kid and when you think about the fertility journey, what are some of the biggest fears that you have going into it?
Sure. So I definitely think that, it's not something that ever occurred to me I would need to plan for, because the way that I think all of us sort of envision becoming a mom in our younger years is, okay, we meet someone, we fall in love, we try for a baby, the baby shows up, done and done. And you never realize how long you carry that notion until things change, and things can change pretty quickly. I don't know, Dr. Stephanie, if you could tell me a little bit more about that as my first question.
Yeah.
Kind of, at what point should I have started, and is it different for Black women?
No, I think that's a great question. I think first, we are misinformed and not educated about our own reproductive system and our own fertility, right?
We learn about our periods and that's it.
That's it. We have to rewrite women's healthcare, and we have to rewrite women's education from we're young. I think we start thinking about our fertility by just learning our bodies when we're teenagers, doing things like tracking our cycles, learning about symptoms with our periods and things that are normal and not normal. And so by the time you get ready to have a child, I think you have a really good understanding of what works for you and what's normal for you. And I think also finding providers throughout your life, who listen to you, is super important. when it comes to fertility, a year of trying to get pregnant is considered infertility if you're under 35.
Wow.
If you're over the age of 35, it's 6 months. But when should you be thinking about it? I think from the very beginning, but it's not our fault that we don't. Like, we're not taught that. So I think just by having these open conversations, asking our moms, asking our siblings, asking our friends kind of what they went through, it helps us to start thinking about, ourselves. And to that point, it's never too late to think about, at least ask the questions, and talk to a professional, right, before saying this is never going to happen for me. Or, I think trying to be open to the different things in science and technology that we have out there is also key.
Well, even what you were saying about 6 months of trying,
yeah,
I'm learning. And I mean, I'm truly at the front end of this sort of journey.
Okay.
I'm learning that trying has its own definition that I didn't even know of.
That's right. Yeah.
So like you say 6 months of trying, but like,
what does that really mean?
What does that even mean?
Yeah.
And that's why 6 months of just like, look, my man looks so good. I am constantly trying to not get pregnant.
Right.
Okay, like that is the blessing. Okay, I'm grateful, right? But I don't even know
what does that really mean.
The art of making a baby.
Absolutely.
Is a different situation.
But that's why it's so important to kind of know your own cycle, right? Because if you're somebody who has a period 3 times a year, your trying is different than somebody who has a period once a month.
And that's so normal. Right? That might be normal to me. So people listening right now, literally, Whitney, might be like, oh, I thought I was doing everything right. And I didn't even realize it's been 8 months of us wondering why we haven't had a baby, and we're past that curve.
Exactly. And we're not ovulating.
Wow.
And theoretically, the egg is only living for 24 hours that you can actually fertilize an egg. So you literally only get that amount of time per month. So if you think about it, somebody, who again is ovulating 3 times a year, has such a small chance of getting pregnant, no matter how old they
still
are.
Can.
Oh, but they still can. So you absolutely need to, if you don't want to be pregnant, you need to be on birth control. Right? No matter what, too. But yeah, you definitely, it's very helpful to kind of know exactly when you're ovulating so that you can actually, to your point, try per se, right?
Right. This is so I danced around it. Fears. All right. Okay.
Yeah.
Fears, like you said. I think one of my biggest fears, I'm not even kidding, is the statistic around Black maternal mortality.
Yep.
I am not so worried about, once I'm pregnant. Obviously, I'm worried about the process.
Right.
Yeah.
But once I'm pregnant and kind of getting through that process, dealing with any things that may come up, there are answers for that. And somehow I feel like, and this may just be my perspective society-wise, while you're pregnant, people pay a lot of attention to you.
Yeah, for
They're
sure.
very like, how are you doing?
Curious.
Are you okay? Curious, right?
Very.
Like
Everybody,
doting even, how can I help? Because it's easier because we see you pregnant. So they're willing to pay attention.
You're worried about the labor and delivery portion.
Right.
Yeah,
I'm
that
worried about the
peripartum period. Absolutely.
I'm worried about not just because all the stats that I've seen about Black women who've passed, very close to, because I heard that it's even a year after it's still considered as due to the pregnancy.
Right.
So explain to me, why is this mortality rate for Black women so high? Like, I don't understand why it is still this way.
I think there are various theories and contributing factors. First of all, there's an innate bias in healthcare. And that goes back to the days of slavery, where women and slaves were operated on without anesthesia, because of this preconceived notion that Black people did not feel pain in the same way. And that's actually one of the roots of how slavery, kind of became entrenched. You're looking at Black people as less than human.
It was like a wall that they put up, some sort of like
to make it
mechanism
easier.
for them to
Absolutely.
make it easier to abuse them.
And it's a belief that still exists today. I think that there's
it
a
does.
study that recently happened at, I don't want to, maybe
like
University of Virginia, I think it was, where they stated that they tested medical students and they said, do Black people have thicker skin than white people? And it was something like 75% or something said yes.
That is exactly right. So there was higher pain tolerance in Black women. And 50% of medical students actually believed that there is higher pain tolerance.
Right now,
That's
present
so
day, current
insane.
stat.
Like
Current
actual
day.
medical students that are like smart, like
that are working right now, that are out in the world
but
seeing
we're not
patients
taught
right
about
now.
this.
Right.
Going through medical school, this is not part of our curriculum. At least, the many years ago that I was in medical school, I think now we're doing a much better job. But we were not educated about cultural just cultural sensitivity.
Of course.
And really our own innate bias. Because we have to remember that healthcare workers and physicians are also people too.
Yes,
we're
that's
humans
so true.
first.
Yeah.
So we bring a lot of that to the table. And I think we all have a lot of unconscious bias in many ways.
Mm-hmm.
And we're so focused on the science that we're not taking a humanistic approach. So that, again, we have to be retaught on how to do that. So I think, again, that's the innate bias in the healthcare system. I think absolutely. And I think the other thing when you look at Black women and maternal mortality, it's not socioeconomic. Okay, it doesn't have to do with the level of prenatal care you receive. It doesn't have to do with how wealthy you are, where you live. And my opinion on that is I think the constant stress of being a Black person in America, absolutely has an effect on your body. And that's why you probably also see, higher rates of high blood pressure, preeclampsia, all of it too.
Yeah.
And then going into a pregnancy with those risks, like I have high blood pressure, and that has already, I was told that I need to find a OBGYN who can both address those high blood pressure issues, like, and has some specialty around that, as well as someone who can deal with a geriatric pregnancy. So I'm like here, like, oh, am I all right? Can I, can I really be doing this?
Listen, I'll tell you, these days, it's very common for women to have babies over the age of 35.
Yes.
And most women do very, very well. I will reassure you that. And most Black women, most people do well. It's just the fact that, yes, the risks are higher. And it's something that you have to be conscious of. You should make your healthcare provider know that you are conscious of that.
This is something that you're scared of.
And this is something you're scared of as well, too.
The hard part is being a Black woman, though, being
voicing
believed.
that.
And voicing that. And
that's right.
safe. It's
and being
both,
an advocate for yourself and being an advocate for your health care, too.
That sounds exhausting.
It is
it's
exhausting.
Like to have to constantly be... while you're pregnant, to have all these fears that everybody has. And then on top of it, this completely unnecessary one that's like, is my doctor going to take me seriously? Like, I can't, it hurts my everything. Like, I can't, I just can't even fathom. And it's true. It's like the socioeconomic thing. I had a friend, a Black woman who went into Cedars, like totally successful woman, and she had a horrible experience there, like on the verge of death, and like completely says it was because no one was listening to me.
Look at Serena Williams.
High profile.
Yes. And
you would think that you would take some less care of Serena
Well,
Williams.
we know she wasn't having cheap doctors.
Right.
We know that she wasn't waiting in the ER,
right.
And yet here she is facing that. And what's nuts about all that is those are the ones we hear about.
Right.
That's
I
right.
mean, I have tons
true.
of friends that haven't filed lawsuits, that didn't make the press, that are saying, look, I actually, just being completely transparent, don't have too many Black friends who've had babies where they're like, I never ran into a situation where I had a doctor that it was seamless, without an issue.
Yeah.
Unless they had all Black doctors,
right.
or they specifically engaged a system of advocacy around them.
That's right.
So, I mean, I want to ask about that because, we've talked about the issue, but like, I'm thinking I need everybody. Like, I need a midwife.
Arm yourself.
I need
arm yourself with a team.
Yeah, literally. Like, I need, and so what does that look like to have a support system on the back end to, talk the talk? Because I can have my husband in there, but he doesn't know what he's saying.
Yeah.
I can have my African mama in there and she's just going to scream.
Right.
So what are we going to do?
Right.
Yeah. No, I think it's tough because there is also a balance of the science and the healthcare, and then also a balance of, advocating for yourself and, knowing what's right too. So I think just educating yourself as much as possible about where you're going to be delivering.
Sure.
Again, just being as much of an advocate for yourself as you can. I know there are a lot of, especially on the East Coast, and I'm not sure about out here, they have doulas who can absolutely participate with you and just, have that conversation, give you that emotional support and that moral support, and just try and decrease your stress level overall.
Yeah, there's
I think makes a lot of sense.
organization in Inglewood called Kindred Care, and they're fantastic. They actually partner with Elaine Walteroth. I don't know if you're familiar, former teen editor of Vogue.
Love her.
She is amazing, and she's a huge proponent of raising funds for Black maternal care and things of that sort. And they are an advocacy for they're pretty much like, look, we can help you with the midwifery, but we trust medicine. We just want to make sure that you know
Your
what to
voice is
ask and your voice is heard.
Yeah.
Exactly. And that's
really
part of
powerful. And
educating
don't all
yourself
women
as well,
need that?
too.
Let's just be honest.
We do.
Someone on by our side.
Yeah, we absolutely do too.
But I think it's important that women have this education to know that this is something that is like an innate bias that everyone is hopefully working on, but that they need to be in control of the narrative and like take care of themselves to set themselves up for like the most success once they get into the labor and delivery room.
Absolutely. We also just need more, minorities in healthcare.
Yes.
At the end of the day. Did you guys know at this point in time, there are less Black men in medical school than there were in the 70s?
No way.
Yep. We have less Black men enrolling and graduating from medical school.
What about Black women?
Black women are up.
Yeah.
That's
Black women are up.
But Black women are the
men are not.
highest degreed, highest accomplished educationally of all races.
Yep.
So they have the most degrees, the most education.
Yep.
So like that's in keeping with norm.
Yeah.
But it's also like that really does matter a lot.
Of course it does.
I moved here from Atlanta, and one thing I loved about living in Atlanta was I was like, I have a Black dentist. I have a Black, chiropractor. You know,
it just gives you a certain level of comfort.
Absolutely.
And you feel seen. You have something in common with that.
Right.
But while we're still working on that, we need to make sure that everybody else can see you as a Black woman, as a Black person, and understand those issues that are unique to you, and then be able to help you move forward too. Because, we're never going to get, I think in our lifetime, we just may not get there in terms of healthcare workers, but we can at least have everyone else have some sensitivity. And I think in the fertility world, we're really working hard on that as well too. Because I get so many patients who will say, I had fibroids and my doctor said I should just have a hysterectomy and I'm 32. But now I know people who did it. Okay. They had the hysterectomy because it's their doctor.
Right.
That's right. Yep. Yeah. But their doctor usually wasn't a person of color. I mean, I'm from North Carolina.
Totally.
And you all probably know about all the involuntary sterilizations that happened there, even up to the 70s. So it's really, it breaks my heart when I have patients come in and, have had inappropriate procedures just because they weren't seen. And nobody asked them, do you want to have a baby in the future? Or maybe they had kids. I'm like, oh, you already have too many.
That's right.
There we go.
Right.
You don't need to have any more.
The judge,
right. Or the sheer time lost. I know that I have been told, during my fertility journey, that, well, you already have 3, and so are you sure you don't want to just think about it? Or you have such a high stress lifestyle, and so just all these sort of assumptive things when you're kind of like, I really didn't come in here to discuss if that was something I wanted to do. I came here for information.
Totally.
Nobody can tell you what your family planning looks like.
Nobody.
When your family is complete, right? That's something that only you can decide. And, I think we do too much of that in terms of judgment, but we don't know what your ideal family looks like.
Totally. I mean,
that's okay.
It's true. It's like there's judgment, and then it's also just the sheer questions, which I've had to really stop myself from doing because before kids, I would be like, oh, are you breastfeeding? Or are you going to have a second? Or, these questions that I realize now are so triggering.
Yes, and they're loaded. You think, are you breastfeeding?
Loaded.
And you don't know if that mom's feeling bad. And I'll just be transparent about my own stuff. I definitely want to breastfeed for as long as I'm able, but able is actually not a physical thing for me. Able is going to be mental
as well.
100%.
And it's also going to be time constraints.
100%.
Because as the sole provider for, my kids post-divorce, it was, I have to work, So there are lots of moms who don't breastfeed right from the beginning, not just because they can't, but because they have to work.
Exactly.
Breastfeeding is one of the hardest things for a woman.
It was the hardest thing I've ever done.
No one ever told us that.
Yeah.
I mean, even
why is that? I'm just asking because I don't know.
I
I
think
haven't
that now
done
people are starting to talk about it, or maybe it's just because I'm 38 and I'm in this world and I've had infertility and issues with breastfeeding and all that stuff that now I feel like people are talking about it. But I feel like if you're just thinking about getting pregnant, you're still not, those resources, those Instagram accounts, CCRM is not popping up on your feed.
That's true.
It's only until you have the
baby.
problem that you're starting to learn about it. Like for the breastfeeding thing, I was the same. I was like, oh, well, if I get milk, I'll just do it for as long as the milk
all
comes
we're gonna
in.
do is put the baby to the boob and they're fine.
No idea the mental and physical toll that it took.
And the pumping,
all
everything.
I have a good friend of mine named Ashley who could make milk and everything was great, and her baby was allergic to it.
No.
And so literally she pumped for a year and like, I'll change. She went vegan. I mean, she was doing everything to try to feed her baby from her body. And she finally had to reconcile after a year, this is not going to happen. And it's actually worse for me to try to do this. And it was a beautiful thing at the end. She was able to donate all of her milk to a foster family.
Oh, amazing.
So it was a beautiful thing. And I told her, I was like, I wish you could save it for me. Because
totally.
that is like
liquid gold.
Oh, I mean,
exactly.
that is like
Liquid
Erewhon
gold.
breast milk. Okay, she is vegan. This is like high-end, top tier. I was like, this is gourmet. Like I need this,
It
you know.
is.
But all that said, you know, I don't think like you said, we talk about it. And also, I wouldn't even know. I'm still here trying to figure out how to get the baby.
Right.
I wouldn't even think.
You're not even. You think that's going to be the easy part.
Yes.
Right?
I mean, once the baby's here, it's just navigating
Right.
It's
that
just like
portion.
keeping it alive, which is
Right.
totally
It's like,
easy.
throw some fruit snacks, you know, put away the electronics. We're good, you know.
gosh.
Cover the corners.
Right. So much more to
But
it.
a postpartum period is probably one of the most neglected portions of women's health care. That time immediately from delivery. You don't, unless you have a C-section, you don't see your doctor for 6 weeks.
Yeah, it's
so much can go
crazy.
wrong in 6 weeks, again, with maternal mortality, and two, even with things like
Now,
breastfeeding.
is that just standardized or is that by choice? Is that like kind of what's the sort of medical?
That's the standard is
Got
6
it.
weeks. If you have a C-section, usually seen 2 weeks afterwards, and then 4 weeks after
Can I
that.
just
I had
say,
to call my.
that's
go ahead.
crazy.
I know. I had to call. I was after 2 weeks. 2 weeks after Sunny, I was like severely depressed and was having really crazy visions of like him, like me getting home and like him being on the ground, like his skull cracked, like weird, crazy visions.
Wow.
And so I called my doctor, and she called me back, and I remember her asking me like she was like, do you have any feelings of hurting yourself or hurting your baby? And I was like, no, not those. And she was like, okay, well then you're probably fine. Like we'll talk in a month. And I was like,
month. Oh wow.
Okay, visions for another month.
Right, visions for another month. You just have to
Bye.
your hormones are just balancing out. You'll be fine, girl.
which is
well,
like, I guess.
And I'll tell you guys too, broken healthcare has a lot to do with the system of insurance companies and all of that too.
What
There's
you
a
pay
lot
out
of
of
things
pocket.
that are dictated not by us physicians,
Of course.
okay,
True.
but by the system.
Of course.
So, you know, in other countries, there's much more supportive postpartum care. In fact, in some Asian countries, you can actually go to a postpartum center.
Oh yeah,
Right?
In
And-
Korea, they send
yes.
home a postpartum nurse,
Absolutely,
and it's
for your
actually a
recovery.
sliding scale based on your income. So for as little as $20, you can have someone come stay with you for something like 2 months.
That's so
to aid you.
interesting.
Yeah, it's just
You know what's
understood.
interesting though to me is because I feel like, and I could be speaking incorrectly, but the culture for women there feels different, like insuperior. So it surprises me that they would do that for women, which is amazing.
But enmeshed in I think certain things are enmeshed in the actual culture. So like in African, both my parents are from Ghana, West Africa, so I consider myself Ghanaian. It is understood that when someone has a baby, we are collectively raising our child.
Right, as a
So
village.
like I have
It really is
it's
a
a village,
village.
you know, and I
philosophy.
think that's, I mean, in America, we don't know our neighbors.
That's
you know
right.
what I mean? So
So
I think
true.
that that's a part of it.
Every
you
man
know?
for himself here.
Right.
I have here that says infertility is higher in Black women than in white women and continuing to increase. Why is that?
I think a lot of it is actually now we're recognizing infertility in Black women,
Okay.
right?
Mm,
I know.
okay.
And I think when Black women present finally to us, they're more complicated. You know, I always say my Black patients come to me 5 to 7 years later than I would have loved to see them.
Wow.
And most of the time, it's not that they, you know, weren't trying at that point. It's that they just either they felt ashamed. You know, there's a cultural stigma to it. Everyone else is surrounding them with all kinds of chatter. You know, they're not sure of their resources. You know, they're not sure if they have insurance coverage or whatever it may be. Lack of support system, holding it all in. So I think the length of time from starting your infertility or your fertility journey to actually presenting to fertility specialists is longer. I also think there's an underdiagnosis of conditions like endometriosis. You know, when you're in medical school, you're taught white women have endometriosis and Black women have fibroids. Well, there are a lot of Black women out there suffering with endometriosis and undiagnosed endometriosis, which is one of the toughest things for us to deal with as fertility specialists. So I think that makes it more prevalent that, you know, Black women are having a tougher time.
Right. So you're saying that they're not being diagnosed with endometriosis.
Yes.
They're being told that they just have fibroids.
Well, I'm saying that they may have pelvic pain or painful periods. And because we don't traditionally think of Black women as having endometriosis, then they're just told, take some Motrin, it's fine. Right. We're more likely to diagnose a Black woman, with fibroids, which fibroids are not necessarily a difficult diagnosis in the sense that we see them on ultrasound. We feel them on an exam. Endometriosis can be a much more difficult diagnosis because you can't always visually see it. So it's based on symptoms, and you have to take an interest and be concerned about it to look further for endometriosis.
Got it.
So we're not doing that with Black women.
Got it. In terms of postpartum issues as well, are we seeing more of a like a higher rate of those issues with Black women as well, or is that something that's not also being looked at
with endometriosis and
with
fibroids,
postpartum
or just
depression, postpartum issues?
Absolutely, and that all contributes to, because we can talk about there's mortality and then there's morbidity. And morbidity, in general, we're also looking at things that are complications. So higher rates of preeclampsia and high blood pressure after delivery, which can lead to seizures, uncontrolled gestational diabetes. I think in America in general, we have an obesity epidemic.
Right.
Okay. And it's bad in Black women as well, too. So, lack of good information about nutrition and how to stay healthy during your pregnancy also leads to postpartum complications too. Depression, you bring up, there's actually finally a drug that's finally been approved for postpartum depression.
Oh, no
so
way.
Nobody should be suffering, for that length of time while they're waiting, because it's a huge issue.
It's a huge issue because then you're also breastfeeding and you're thinking, I don't want to be on a medication, but your mental health is really like the most important thing at that time. So it's so complicated for women. But what it sounds like what you're saying is that it needs to start, the education needs to start at an earlier time for everyone.
For everybody.
For women, for Black women, everybody needs to be
men,
armed.
For men to
Exactly.
understand exactly about our reproduction, right? We're not telling everybody to go and freeze your eggs at 18, but I think the point is that you have to understand that fertility is finite. And, I like to say our society has not caught up to, our biology has not caught up to our society.
Right.
Okay. The ideal time for us to actually get pregnant is when we're a teenager, and I think we also don't realize how it's not that easy to get pregnant, even when you are young.
Right.
Like, it's never 70% per menstrual cycle that you can get pregnant, right? The highest that ever is per cycle that you could get pregnant is about 35% chance of success. That goes down to 1% by the time you're 45. So, I think we need to know that kind of stuff, just to have it in the back of your head.
100%.
No one's saying that you should go out and get pregnant when you're not ready either.
Right.
But we have technology such as egg freezing that can help with that. It's just a matter of knowing the facts, knowing the statistics, so you're educated to apply it to your life.
Right. Yeah. But that doesn't even feel like it's our responsibility or our fault that we don't know.
It's not our fault.
Right.
It's the institution's fault for not teaching us all this.
And, and also culturally, like you were mentioning, as like women, I think we're always told, that's our job. Like, we work and you should be able to have a baby and that's just it.
You need to be educated about all of it and know it. And like put the timer when you turn 32.
Right.
Well, nobody thinks they're going to be infertile. It's your natural human right to have a baby, and it should be. But the incidence of infertility keeps going up. It was 1 in 7, now it's 1 in 6. And I think there's so many factors. There's age, there's environment, there's male factors. Luckily, we do have great technology.
Well, what's amazing is that, like, I'm learning just in this journey and from my research with CCRM and from my research and talking with people there, that there's also so many steps before IVF. I think, being sort of a child of the 90s, that was kind of the conversation was, oh, you can't have a baby, test tube baby.
Right.
And that was stigma. Right.
Yeah, exactly.
Welcome to octuplets. Like that was a sort
that
of
was
like,
a stigma.
And if you want to hear about birth control, promise me 8 babies. You know what I mean? And it's like, do I really want to be a mom?
We really don't have a lot of multiples these days.
Right.
We are really aggressive about not having multiples because of the pregnancy complication.
Right. And there's steps before the steps. And for me, that's actually been one of the most encouraging things as a 38-year-old starting this journey is realizing, well, my gosh, there's like, I could just take a pill to like stimulate my ovulation for a while. And that could end up getting me pregnant. Like, and then after that, I could do this. And then there's like a long road before IVF. And I didn't know that.
There are a lot of options for sure.
Yeah.
Definitely. Yeah. And I think it's so important too, also, like, it's great to talk to your friends about their journey and get Dr. Google information, all that. But, every case is very unique.
Right.
So it's so important to be, I think, with a doctor you trust. And have transparency.
Get your numbers.
Get your numbers, get your numbers and talk about what your chances are realistically and what that looks like and what's best for you and, how you want to go about it. Because sometimes, to your point, you do kind of need to get your feet wet and just thinking about the whole process.
Totally.
Like, what is it looking like to even walk into a fertility specialist office? I think COVID was a game changer when we went to a lot of telemedicine.
Yes.
It was one of those things, like, it was awful and the world was shut down, but we had to find other ways to cope. And I find that a lot of patients are much more comfortable with just being able to log on to start
issue, email their issue, call.
The technology, from an interaction standpoint, really helps because so many people are scared to just have that conversation. I can't tell you how many
times. And they can be anonymous.
Right. And I get on a call with a patient and they're like, I was thinking about this all week. Like, I was so scared to talk to you all week. I thought you were going to tell me I would never have a baby. I'm so anxious about it. I almost canceled. I just didn't want to hear it. Yeah. And they're like, oh, now I feel so much better.
Yeah,
right?
exactly.
They feel
Because information and education is empowering. I know that we get anxiety when we don't know something or we're not in control, but there are some things that we can do to take a little bit of the control back. And like we talked about this in other episodes about when you should be thinking about freezing your eggs and all, the age constraint, the ages for everything. But for you, are you thinking about freezing eggs or?
So it's so interesting because the approach to fertility from my conversations I've had with the experts is sort of, how much of it do you want us, which is also, can I just say, really nice? Like, it really is driven by what you want if you're with the right experts, So like CCRM, one of the things I loved about their approach is the fact that it's very, what makes you comfortable?
Right.
It's not, hey, if you want to push
you into this
is what we're going to do, And so for
Totally.
us about freezing and all that, the big conversation is, well, we do kind of want to feel a little bit like it's happening organically, And so that is a huge driver of it. We're not doing freezing yet. We're not jumping into all of that. And we are informed about what that means.
Right.
If they're like, hey, if you want to do this, we do lose time here.
Yeah.
Right.
And that may remove these options later. Yeah. But we still have these options that exist.
It's good that they're telling
you have a
that
partnership.
from the
It's a
get-go.
conversation, right?
Right.
And also they were like, what I really, really love is if you don't have this, and this, well, guess what? If you're experiencing these things, like you said, 6 months, you can always come back and then we'll do this.
Right.
Totally.
So there's a lot more flexibility, I think, with fertility than people know, and that I think makes it more approachable.
And like you were saying, a lot more options.
Options, yeah.
A lot of options.
Yeah.
Definitely.
I mean, even for us, I was telling them before you got here, we're using a surrogate and our surrogate's 6 weeks pregnant. I know. And it's still, but it's there's like a whole other like set of anxieties and emotions and things, And I'm like, I feel so grateful to be doing this, but it's just a lot no matter what.
It's a lot.
It's a lot no matter what. Whether it happens naturally or not,
right.
It's a lot.
Between the two of us, we've got just on this side of the table, surrogacy, adoptive mother, biological mothers, wannabe bios. Like we get the feels,
Right?
Black mom, white mom, all the feels, you know what I mean? Like,
and we haven't even touched on things like recurrent losses.
Yes.
Did you know that infertility is considered as a medical diagnosis one of the top 3 stressors? It's right up there with a cancer diagnosis.
Oh, wow.
So that's why I've lost all this weight.
That's
and
why
I'm
you
like
feel it.
stressed out of my mind.
Yeah.
And I said to Timmy this morning, I was like, this anxiety is like, it's taking over my life. It's making me not be able to do other things that I should be able to do, or it's making other things sound worse or exhausting.
It's paralyzing.
Or it's paralyzing. And I'm just like, I feel so guilty saying that because I don't want people, it's a privilege for me to be able to use a surrogate. And I feel so lucky, but I'm also
but there's so much guilt that doesn't take away with that. It doesn't take away from it. Like realistically, I think people forget that you're just trading anxieties. The anxiety of carrying your baby in your belly versus the anxiety of someone else doing it. You know what I mean? Like it's just you're becoming a mom again, and that is what this looks
and
like.
That is, and I have to keep on telling myself that. Yeah. For young women who are maybe not ready to start building a family, how early would you say, like, when should someone really come to see you?
Yeah, no, that's a great question.
Yeah.
I think that around 30, if you're talking about egg freezing, is really a great age. The younger you are when you freeze your eggs, the better the outcome.
Right.
And I have some women in their mid-20s who are prepared. And, you know, now that we're seeing a lot of insurance coverage, a lot of women who are on the younger side are taking advantage of that because they may not be with that company forever, right? And they should. But, you know, we know that the outcomes are excellent. The younger you are, the better. It doesn't mean that the outcomes, you know, can't be good later on, too.
Of course.
But I encourage women, if it's on your mind, you know, if you're in a situation where you do have good coverage, it may be something that you want to explore.
How long does that process take? And how much is it on average without scaring people of the numbers?
Yeah, no, I think that's a great question. Really, the meat of it is about 2 weeks. You know, we do sometimes some prep, but the meat is really about 2 weeks.
From conversation to harvesting?
No, from start of injections to the egg retrieval.
That's
is about
really
2
fast.
weeks. Yeah,
it's really fast. So we did this too because I was originally going to do the transfer myself and then hit a rock bottom and couldn't do the transfer, but went through the egg freezing thing and obviously made the embryos with Timmy. And it was not as intense as I thought it was going to be. Granted, it was Timmy, you know, giving me the injections and all that stuff and bloating and whatnot, but it's not something to be afraid of.
Right. I agree. And I think the more we kind of talk about it and normalize the experience, then we get less anxious about it. So
There's
much
no
of this
pain
anxiety.
Afterwards. I mean, granted, I was a little bit hyperstimulated, so it was a little bit hard to walk.
Though.
Exactly,
You know what I mean?
but not anything to stop someone who's thinking about it from doing it.
Nope.
You know?
One of the beautiful things I heard about the egg freezing process was that once you go into the embryo process and all of that like you put this baby in you and you're like, what, 3 weeks pregnant already or something like that?
And I'm like 2 weeks for free.
I mean, I'm like, okay, wait a minute. So are you telling me that I could literally put baby on my calendar? Like, I can't wait to get pregnant on November 15th. Yes, we're going to go to Saks. Then we're going to do this. Then
and then we're going to have our transfer.
I can have family in town. We can buy plane tickets, y'all. It's transfer day. Come we are pregnant.
Those are the pros of it. Like, I know you talked about
the timing.
Right. And like, I know you talked about it not being as, quote, natural or, you know, organic, but you get to a certain point where you're just like, you just want this baby and let's just make this fun. Let's if I can plan, let's plan.
Oh, I know. I get all kinds of requests of transfer dates.
Yes.
Lucky day, anniversary, whatever it may be.
For us type A people, send me a Google meeting request. Let's put this transfer on my calendar. We'll just tag in everyone else. We'll have a Zoom call like I'm here for.
Yeah.
You know?
To your question about the dates, so when you have a positive pregnancy test, you're 4 weeks pregnant. And that's either with IVF or without, naturally. So you kind of always get 2 weeks for free, we call it, right? So because it ended up being 4 weeks.
Oh my God.
But yeah, you can totally schedule your transfer date. Kind of fun.
Yeah.
Are there any other options?
With
that process, so do you get to pick a boy or a girl? Do you get to pick, you know, one or two? Like if you want to have twins, can you have twins with
we
that
really
process?
Discourage you. Highly discourage you. We do mostly single embryo transfer. We can know the gender. We do that by looking at the chromosomes. We can't make you have a particular gender, but if you have a boy and you have a girl, absolutely, you could request that. And usually we have a discussion about that, and we look at all the embryos together.
But they let you choose whichever you want without judgment. They give, my doctor gave us grades for the embryos, which I kind of felt like
your kids are going to be graded for the rest of their life.
I was like,
you said that about grading, because grading to me is really a great tool for the embryologist. But I always tell patients, look, if there's something in particular, if you wanted a boy or a girl in particular, just ask for it.
Exactly.
Right? Of course we grade the embryos. Of course they have all these systems.
It's for you to know, of
that
course,
are for you to know. Yes.
Right. But then they're like, I got 5 embryos. 2 are girls, 2 are boys, 1 is unknown. And they're like, well, the boys are stronger, graded higher, but the girls still will totally be
Make
okay.
Of course.
And I'm like,
well,
why did I even need to know?
Yeah. Pregnancy potential between all of the embryos, it's not a huge drop off for the most part. Now, there are obviously nuances. There are obviously embryos that are definitely on the lower end of the spectrum than others. But, by the time you're getting to doing an embryo biopsy and you grow them to what's called a blastocyst, which is where it normally implants in you, we're talking about generally high quality embryos.
Right.
And to your point, too, about twins, why we don't transfer more than 1 embryo is because the success rates are high.
Sure.
So putting back multiple embryos only puts you at higher risk of twins, which leads to more pregnancy complications. So we really don't want to do that. Back when we were putting back 2 and 3 embryos, 20 years ago.
Hope that one stuck or was that the idea?
That was the idea because our embryo culture systems were not at the level that they are now.
And what would happen there? I mean, did that help or did that?
It did at the time because we didn't have as many selection tools.
Sure.
Now we have a lot more in terms of being able to.
Exactly.
Yeah.
Good to know.
Absolutely.
Well, we did talk a little bit about the monetary part. I love that insurance. I think that, so I come from a world of insurance before. That was my last corporate job. And I think so many people underutilize, not even I think, I know a lot of people underutilize their insurance from anything from therapeutic coverage, from mental health.
I know my best friend just told me I need to be submitting my super bills.
Yes, you should.
Yeah. Listen, you're paying for it. I was just talking to someone at the hotel I was staying at and, she works for a big corporation. She's like, I need to look into my benefits.
Yes, and it's likely covered. Like some degree, it may not be covered in whole, but some degree. Or you may have like 2 or 3 free sessions.
Yeah.
So even if it's
you can use HSA, et cetera.
Or EAP is usually what it's called, which is like a program that where you can get 2 or 3 sessions per issue with a therapist at no cost. So I mean, there's a lot of things built in there, but I think that fertility is something where a lot of people don't think it's in their insurance, and it is there, but you feel like you have to have like a certain point of a lack of success before that's a thing.
Exactly.
When are we able to engage?
Right, with the benefits.
Yeah.
So they do usually adhere to the 1 year of trying for under 35 and 6 months
How
of
are you
trying.
even proving that? Do you know what I mean? Like realistically, they'll be like, your man looks really good. I know you're trying.
Right.
Like we believe that.
Regular intercourse around that time.
Or
so that's how it's
for
defined.
me, they would see it by like miscarriages and doctor's visits and things like that.
Absolutely. But generally, it's my history. It's me talking to you. You know what we do.
Knowing and
got it.
Yeah.
They submit paperwork to their boss like, hey, Jim, so
I've been having sex for a year.
I've been having sex
for
a year, and I'd like my insurance to cover this. I promise. Like, so, if it's not awkward enough, right?
Right.
I know.
Oh my gosh.
I have to ask for that.
There's 17 states that have a mandate for infertility right now. And, our goal and part of what CCRM does, what other fertility clinics do, the advocacy portion of getting coverage, we need to expand that to all 50 states. And, I believe that we probably will nationwide at some point because of the low birth rate in America.
I was just about to say that.
So we should.
That's what you were talking about when you said that, like, our bodies haven't caught up with our lifestyles. So,
That's
like,
right.
We have this low birth rate, and I think people blame it on a million things, from too many plastics to pollution, and, everything is a contributing factor, right? But no one's really talking about the thing that I think women have been screaming from our rooftops. We're busy.
We're busy.
We're
That's
busy.
right.
Like
That's right.
having kids is not our number one priority anymore.
And
And
not even
time
by
flies
choice.
so fast,
Yes.
right?
Like
thinking about
households.
it.
For
Yes.
some of us, like, I have to work because I have to support just myself,
Right.
and
Right.
it's required, like, for my mortgage or for whatever. So
Right.
I need things that, like, if you want me to be able to have babies, because I'd like to, I need to have laws that support that as well.
You also need to have adequate childcare, because a lot of
Yes.
things women get very anxious about is what happens after I deliver and what happens to my job.
Right.
What happens to who's going to take care of this baby. We don't have the village
Right.
that you were describing.
No.
We need to do a better job of that as well, too.
You can bring him to me. Auntie Nicole.
Yeah.
I love a baby. I'm like, bring him over. I'll take all the babies. No, I love that. Oh my gosh, this is so good.
I
like,
know.
all the
What did
things.
anything else that I missed, or from you guys too? Like anything else in terms? I just want to make sure that we're covering all of the issues and the important questions that anybody would have. I mean, we talk in all my other episodes, we talk about the egg freezing and the embryos, and we're even doing a financial planning one where we're going to talk about.
Oh, I've got one. That would be a really good one, especially for Black women.
Yes.
How to talk to your partner and your family about it.
Oh,
So,
that's great.
should I just go into it?
Yeah,
Okay.
go into it.
So one thing that I know comes up, and I say this just because I'm African, right? So culturally, my mom is like, oh, I love my kids, I love my children, but also you can carry your own. People will say you are barren, I mean, and she doesn't even mean it in a negative way. It is just culturally, you are expected to have your own babies, like carry them. And, that also translates into partnerships and spouses.
That's
so
right.
what do you recommend, knowing you facilitate these conversations all the time, getting your partner on board if they have preconceived notions and stigma, making sure that other family, or do you just not tell them? Because I'm very team, it's my business also.
When it comes to the partners, I'm very insistent they participate in the conversation.
Agreed.
I'll say, just dial him in, please.
I love that.
Right?
I love that.
Always would need. I would want Timmy there because I'm like, I need someone else to hear all this information.
Absolutely.
So, like, for
To
every
hear
woman
it.
out there, it's a lot for if you do have a partner to take advantage of them because it's very overwhelming.
Yeah, you need the support. And I kind of go over the reasons for infertility in just a very straightforward, non-judgmental way and bring in male factor, right? And explain to them why it's so important that they get tested as well. And then sometimes they'll go, well, I've had a child before, et cetera, et cetera. Well, first, the thing about sperm changes. Okay, the life cycle of sperm is 90 days. Right. So a semen analysis can vary dramatically over time. So I explain all of that to them, really try and get their buy-in, talk to them about the reproductive cycle. I mean, guys don't know anything about the menstrual cycle.
They don't.
Right.
Yeah.
So, making sure that they understand kind of the basics of the science and answer all their questions and give them support. We also highly recommend mental health professionals if a couple's having difficulty in being on the same page.
I think that's something that's so amazing what you guys do. We talked about this in the last episode about that doctors, like you need to be therapists almost at the same time and handle all the emotions, but that CCRM has like mental health professionals that are able to work with the families because there's so many different
and all the mental health professionals we work with have a certification from ASRM, which is our society. So they specifically work with reproductive issues, and they're really helping a lot with more coping mechanisms.
Sure.
How to decrease anxiety, how to talk to your partner, right? How to get that support that you need and, approaching the couple as well, too. So I think that's critical.
I love this.
Yeah. As for friends and family, I think find first maybe somebody who you feel is approachable within the family, right? It may not be your mother, it may be your aunt, and you just have that conversation. Start to build your support system around you till you get confident enough to kind of share with everybody. I know that it's such a hard thing to talk about, but I just don't think that we should suffer alone. I think sharing is like one of the most important things.
And more people can relate than usually.
Of course.
Like I didn't know until I got older. My mom is like, oh yeah, I had miscarriages before you and all these things. I'm
Miscarriage
just like,
is huge.
How'd you get through it on your own?
Yeah.
Like, it's a real loss.
It's like 1 in 4 women or 1 in 3 women have
a miscarriage?
Yeah, or is it like every single woman? It feels like every single woman I know.
It's about 85% of women.
Wow.
So first of all, 50% of pregnancies are unrerecognized at baseline.
Wow.
Right? Like it's always a miracle to me, like to even make a baby, knowing all the things I know. But, about half of pregnancies are unrecognized anyway. You may be testing early and you see, a little positive and then it goes away. But most women have had a miscarriage. It is almost normal. It's nature's way of saying that,
upgrading your embryo.
Right. When we do chromosome screening and the embryo doesn't make it to the point where we can test it, we call it the poor man's screening, right? In the sense that it's not going to make a healthy baby. And your body has all kinds of signals between the embryo and the uterus, that a lot has to happen for this to work.
Right.
And so they are like one of the toughest things that we deal with as women because miscarriages are heartbreaking, but it's not you. You're not broken.
That's right.
And we have to let women know that. I've had women ask me, did they have a miscarriage because their heels were too high? Like, all kinds of things and blame that we take amongst ourselves. So we have to make sure that everyone knows that, it's not you. It's very common. It's happened to most of us. It doesn't mean that you won't have a successful pregnancy, later on.
Right.
For sure. So
but that it's a very natural thing that happens to women.
And it's extremely common. Again, most women, have had a loss at some point. So we could support each other a little bit better with
100%.
Oh, if there's anything I could take from this conversation, particularly as a Black woman starting this journey, it's that much like buying a home and going in and talking to, a realtor or, starting college and talking to a college admissions counselor, this is something else where I should be informing myself and letting an expert guide the process.
Exactly.
And Google isn't the best way. And, your girlfriend who did it, great that they can share the experience, but,
but
it costs nothing to go in and ask questions.
That's
why not just do that?
No, you're so right.
Yep.
Super helpful.
And there are a lot of resources out there now. And there's a lot of reputable resources, right? Not just Dr. Google.
Sure.
For us to ask those questions.
I still do that though.
Oh, me
and
too.
I couldn't.
As a baseline.
I got the heartbeat was at 117 today, and she's 6 weeks 4 days, and so of course I'm Googling normal heartbeat.
It's good.
6 weeks 4 days.
That's appropriate.
So that's what it said. But then I'm like, I trust Google.
I do it for stuff with my kids. I'm no pediatrician. Before I can get to mine, I'm Googling.
What did I hear? This is totally off topic, but that TikTok is used as a search engine more than Google.
Oh, great.
Now.
Because we love anxiety.
Yeah.
We literally love to stay in a state of perpetual anxiety. So what can we do today?
That's where people are going to for their facts.
But that's an American construct, right?
So 15 seconds of knowledge. That's all we can tolerate. So, yeah.
Oh, my gosh. Well, thank you guys so much for being on here with me today. It's been such a pleasure chatting with you both.
Thanks for having me. This was awesome.